We're here today with Julie, our community education nurse with Compassioncare Hospice, and we're going to be talking about the levels of care that are offered in accordance to Medicare guidelines.
Right, so our first most common level of care is called routine care, and this includes normal team visits at home and is provided when a patient is stable and not having any distress or symptom management issues, provided in the home wherever the patient calls home.
What if a patient does have symptom management issues? Where would they go?
Well, there's a couple of options, and the first is what we call general inpatient. This is if somebody's having acute distress, something like respiratory distress or their pain is uncontrolled. They could be moved into a skilled nursing facility for oversight and treatment until those symptoms have subsided. It's meant for short-term stay and care, typically lasting 24 to 48 hours.
What if someone is having symptom management issues but doesn't want to move to a skilled nursing facility or a contracted facility?
Right, so another option is what Medicare calls continuous care. This is an alternative level to general inpatient, and it allows the patient to remain in the comfort of their own home while receiving one-on-one nursing support in their own home at bedside. Again, it's used for crisis situations where somebody's having unmanaged symptoms that can't be met on regular routine care. And just as general inpatient, it's meant for very short term until the symptoms subside.
What if someone is being looked after at home by a caregiver and a caregiver has an emergency situation where they can't look after the patient?
Right, so the last level of care is what's called respite care, and this is designed to give a caregiver or a family member that respite, that break they may need. They may have an emergency situation, maybe they're in the hospital themselves. It could even be for something like going on a family vacation, but the patient's not safe to travel and they're not safe to be left at home alone. During each certification period, a patient earns 5 days that they can use in a contracted facility where they're moved into a skilled nursing facility and they're cared for there for up to 5 days. If you'd like more information on how hospice support can help you or a loved one, please call us or visit our website.